we do hear from patients when they're very surprised at what was not covered for their stay or what is not being authorized or that they have to have a prior authorization for something. And I think the point around education is paramount. They do have to know, they do have to understand. The tricky part is being a provider. I don't think it's up to us to steer them, or it's not appropriate for us to steer them into one plan or the other. But I do think we need to make sure they have all the information to make that decision on their own and to understand what they're electing and what each decision means. And so that education part is key. And I think that when they hear Medicare and Advantage, well, Medicare is good, but Advantage must be better and it costs less. And so, and like Rochelle said, it's advertised everywhere. It's on the TV. If you're ever, at home at 11 o'clock in the morning, it's on your TV. If you're awake in the middle of the night, it's on your TV. There's the commercials and, here's what you get that you don't get with traditional Medicare. And so that's what they hear. It's not, it doesn't tell them what they don't get or what their responsibility will be financially, if they don't have coverage. And it's not even to say like, then the piece that isn't covered, how is that going to get paid if they don't have the resources to pay that? What happens to that? And that ends up being something that the hospitals just don't recover. And so thinking about that piece of it as well. So education, partnering with the senior centers to make sure that they understand and that they have the education or the people to provide education, I think is super important.